Uh, Really lovely to see so many people on the sort of the graveyard slot, we call it, of a conference, but it's really lovely to see everyone. So at one stage, my name's Alan Dangor, I'm the Director of Climate and Health at the Wellcome Trust. At one stage, we came in here, there was nobody here, and we thought there's going to be four of us that just sit in a circle. There's more than four of you, which is brilliant, but we're also going to try and make it quite interactive. So please don't just sit there and fall asleep as much as you might want to. Please engage, and we're going to try and have an interactive session. So I'm going to play with my glasses because I'm so tired I can't decide whether I need them or not. But I'm going to be, I'm going to make a few opening comments. So thank you very much for coming. It's absolutely brilliant. We want to talk to you about a coalition that we're building, that we have built, that we are trying now to move forward at the intersection of climate and health, and a coalition of funders, philanthropic and other funders who recognize the importance of this intersection and who recognize that philanthropy has a really, really important role to play in catalyzing action. So let me just say a few words about climate and health, and then let me talk a little bit about the interaction, a little bit about the coalition rather, and then I'm going to invite some other speakers up on the stage. So when we think about climate and health, the intersections are really, really critical. We have, the Wellcome Trust works on health. We're a long-standing funder of research on health. We are a long-standing advocate for the importance of global health, for the importance of multilateralism, for the importance of health for all. And that health equity, that health for all is being fundamentally challenged by multiple things at the moment, but by something that's going to last even longer than Mr. Trump, which is climate change. So climate change is having really devastating impacts on global health in various ways. Number one, of course, the impacts of extreme weather events, extreme heat, extreme floods, extreme rainfall and drought has really dramatic impacts on health. Number two, those pathways between the changing environment, the changing climate, and health, which are mediated by nature. So, for example, if you can't grow food because of the changing environment, that has obviously an impact on food security and health. If mosquitoes can live in new parts of the world where they previously couldn't because of the changing environment caused by climate change, so you see a spread of infectious diseases like dengue and malaria. We have other areas where we know much less about the impacts of climate change on health. For example, what does climate change do to mental health? We have very little understanding of that. So, and then of course there's another pathway between climate change and health, which is likely to be a really major driver of the future, which is how do communities and societies respond to a changing environment, to a change in livelihoods, to a change in food security, to a change in water security. And we're likely to see increasing amounts of conflict, societal breakdown and migration as a result on the current climate pathways that we're on. So I say that last statement, the climate pathways that we're on, because clearly we have a choice as society to decide, as a planet, to decide what pathway do we really want to be on climate. We could carry on as we are, and then in 20, 30 years' time, we'll be, on average, 3 degrees hotter in the planet. 3 degrees on average hotter is, of course, 10 degrees hotter in some parts of the world, unlivably hot. Or we could make a decision to really do everything we possibly can and try to limit the further rise in global temperatures. It's a choice we've got to make. We in Wellcome believe that using the evidence of the impacts on health of climate change brings climate change to people, brings climate change into households, brings climate change into communities in a really powerful way to drive action. If you understand and you see and the evidence is there that climate change is having these extraordinary impacts on human health, you're much, much, much more likely, the health of your family, the health of your children, the health of your parents, you're much more likely to ask government for action. So, with all that said, what's the role of philanthropy? We are seeing that our governments are making some moves, of course, to reduce emissions. We're seeing that our governments are making some effort to drive new initiatives. But the question is it enough? The question is, could philanthropy be doing more? Could philanthropy be the key to unlocking the action that we critically need? So we've set up a coalition, because there are now many philanthropies that actually have a global health as their sort of primary reason for being, but recognize that global health is at peril because of climate change, and therefore recognize the real need to bring in the climate and health together. And so we have set up a coalition in partnership with Rockefeller, but we're now also delighted to be partnering with Temasek and Philanthropy Asia Alliance and many other philanthropies in the room here today as well. Where we're saying, let's coordinate, let's align, let's share intelligence, let's work together, let's co-fund, let's organize our thinking in a way that we can be much more catalytic and drive much greater action on these critical topics. And we work with Bridgespan, and you'll be meeting Sonali shortly, who's going to chair the panel. But the Bridgespan team has helped us think about the various themes that we could be working on. And we're going to be talking about some of them today, but we've got 3 of them up there. So one of them is extreme heat. So there are many philanthropic partners that recognize extreme heat and the impact of extreme heat, especially on vulnerable groups, women, children, older people, as a core theme that it's immediate, it's salient, people understand it, people can feel extreme heat, and you will have noticed that there's an increased amount of extreme heat events globally. So extreme heat is a very good example. Another an action pillar we have is on air quality. So how many people die every year on the planet because of poor air quality? Anyone? 7 million. 7 million people die of poor air quality at the moment, many of them in this part of the world, in fact, in the major cities in South and Southeast Asia. Of those 7 million, 5 million deaths are directly attributable to the burning of fossil fuels, so the pollutants that arise in the air because of burning fossil fuels. So those are 5 million deaths that do not need to happen if we stop burning fossil fuels. So there's quite a large number of philanthropies who also care about air quality, the so-called superpollutants like methane and black carbon that accelerate climate change, but also have negative impacts on health. And then the third area, of course, is that much of this research requires high-quality data. And data are currently, and the availability of data is currently at risk. And we're seeing with some of the cuts taking place in the US that some really, really important data sources are being taken down. And one of the most critical ones is the National Oceanic and Atmospheric Agency, NOAA, where data are being taken down off the NOAA website. And that's sort of climate data that is critical for the delivery of high-quality climate science and our ability to project into the future. So those are the 3 pillars that we're currently working on in this coalition. But of course, there are many others, and as philanthropies join the coalition and talk about their preferences and their priorities, then the coalition builds and we bring in partners. So, and one example I just want to give on extreme heat is we're working in the region, in fact, in India, with the Khemka Foundation. So it's an Indian philanthropy that is leading a project on extreme heat, and it's a really, really good example of local context-specific research and implementation to help build the evidence locally, which will drive local policy. So I wanted to introduce the topic for today's discussion. I wanted to introduce the coalition, the broad thinking. I'm now going to ask Dipali, who's at the Rockefeller Foundation, based here in Asia, to say a few words about her work and the work of the Rockefeller Foundation on heat, and then we'll move into the panel. Thank you very much.
Thank you, Alan, for the kind introduction, and good afternoon, everyone. It's great to be in the room with so many of the foundation partners, so thank you for choosing this session over others. As Alan said, we were expecting to be more creative in the conversations, looking at who is showing up, so thank you for being here with us again. I think it's been wonderful partnering with Alan and the team at Wellcome on the Climate and Health Funders Coalition in addressing extreme heat. 3 years ago, I rode deep into India's countryside to the deserts of Little Run of Kutch. How many of you have been there? I'm sure, ma'am, you would have been there. I was traveling to meet a foundation partner, the Self-Employed Women's Association, or SEVA for short. I spent much of the day amid deep penetrating heat talking with SEVA members about their lives and work. How many of you have experienced living in 40 degrees temperature? Raise of hands. 45? 50? Gaurav, you're a brave guy, right? Some of the members showed me how they pull long pole rakes along the salt flats to harvest that life-giving substance for a living. And the temperature is soaring at 48 degrees centigrade. No roof cover of any sort. Others, like Suman, described how workers here are working so hard for a paycheck that they cannot afford to wait for the weather to cool, despite the well-known risk of falling ill with heat stroke. They have no choice. Even as their drinking water boiled and their lunches grew rancid, they ventured into the sun-scorched salt pans every day. Over the last decade, we worked with SEVA, India's largest union of informal sector workers, to confront new threats and opportunities, responding to a housing crisis, improving agricultural analytics, and more. Now we're helping workers protect their lives and livelihoods during heat waves. Suman and her fellow salt farmers are just a few of the billions of people across the world who are still pursuing opportunities despite the many threats of extreme heat. Extreme heat kills 500,000 people a year. Yes, 500,000 people a year. Fuels food and water insecurity, shifts disease patterns, and widens inequality. Prolonged heat exposure exacerbates chronic illnesses like heart disease, diabetes, mental health conditions, and asthma, straining already overwhelmed health systems. In fact, responding to climate threats like heat will cost health systems an additional, can anybody take a guess? $1 trillion, at least. And while the threat of extreme heat is universal, some face greater risk. The urban poor, elderly, outdoor workers, pregnant people, and young children suffer the most. This isn't just a health crisis, it is an economic and political one. Heat waves drain productivity, disrupt supply chains, and push people into poverty. In 2023 alone, income lost from heat reached a record high of $835 billion. As entire regions become unlivable, heat is driving migration, creating new challenges for displaced populations and communities, and increasing political instability. Humanity has the innovations it needs to help vulnerable people not only to survive, but thrive while averting climate catastrophe. I'm sure all of you in this room agree to that. The good news is that momentum is building to scale these solutions, and that's why all of you are here. For the salt pan workers in India, SEVA installed solar-powered air-conditioned water coolers to provide cold drinking water, helping workers fight the heat by staying hydrated and keep cool. We also experimented on some parametric insurance products. When the temperature rose beyond a particular limit, the women were getting insurance money that could help them stay at home and protect themselves. In some regions in Asia, heat action plans rolled out by local governments have helped reduce heat-related deaths by up to 25%. Investments in cooling infrastructure are also scaling. Initiatives like the Clean Cooling Collaborative have deployed millions of efficient cooling systems and reflective roofs that have lowered indoor temperatures by up to 5 degrees centigrade. So we do have quite a few technologies out there. These efforts highlight some of the tools that we have in our toolbox, including data, policy, and implementation of cooling solutions, along with parametric insurance products that are beginning to strengthen Asia's capacity to withstand this urgent climate threat. In a fractured, resource-constrained world, philanthropies must come together to back bold solutions and take big bets. To help get these solutions into the hands of the people who need them the most, through the Funders Coalition, we can invest with purpose together to ensure the returns for vulnerable people around the world. Today, panelists will examine the urgent threats posed by extreme heat in Asia. They will also highlight examples from different work streams which are underway, and I'm really excited to hear about them. They'll also share how, through collaboration within philanthropy and with government and civil society, we really have a powerful opportunity to build more effective, scalable models for action. Our planet is becoming hotter and more dangerous for everyone. The salt pan workers of India and billions of others can't wait until the next COP for us to get this right. They're at risk now, and they need our support now. Let's use this momentum and partnership to get health solutions into the hands of the people who need them the most. Together, we can save lives and secure futures. Thank you so much, and I'm really looking forward to the panel.
Could I have the panelists come up and join me, and then we can introduce everyone? Maybe we can. Well, thank you all for coming today. I know I'm the third person to thank you for coming at the end of what has been a wonderful, wonderful week. Thank you, Alan and Dipali, for introducing this session. And I'm really excited that Bridgespan has been privileged enough to work with this group of funders in the Climate and Health Coalition. In today's conversation, what we're going to do is talk a little bit about what work everybody up on this stage is doing right now, and then where we see intersections, where we can work together to have more impact with philanthropy, policy, and work on the ground with local funders. So what I wanted to do is start just by introducing everyone on the panel, and then we'll dive into some questions. And once everyone up here talks a little bit about their work, what we will do is open it up to the floor and make this a very interactive session. So all of you have a chance to ask the questions that you might have of this group that's gathered. So I'll start by introducing Mrs. Irani. Thank you so much for joining us for this panel. Mrs. Irani is a former cabinet minister in the government of India, where she served as Minister of Women and Child Development, Education, and Minority Affairs. She's also currently the chairperson of the Alliance for Global Good on Gender Equity and Equality. And we're really looking forward to hearing more about the way in which she thinks about vulnerable populations in India, and particularly women, as we go through this conversation today. Next on the panel, we have George. George Richards is the director of Community Jameel, where he leads the organization in the delivery of its mission to advance science and learning for communities to thrive, and including various projects both in the Middle East and in Southeast Asia. Next, we have Benedict, who I think probably everybody here knows from Temasek Trust, and he is the Chief Systems Integration Officer. He leads a team that works in the areas of systems thinking, knowledge, and innovation to help harness the collective capabilities of entities in the Temasek Trust ecosystem. And then finally, we have Alan, who you all heard speak at the very beginning. He is the Director of Climate and Health at Wellcome Trust and oversees an ambitious strategy around the health outcomes of climate change. So I'm really excited to have this group here today, and really excited to talk a little bit about the work they're each doing in extreme heat. So I'm going to start and open with a question for you, Alan. And as you all know, Wellcome Trust is very engaged in thinking about the health outcomes of extreme heat. And we know that extreme heat differentially impacts Asia, where there are 500,000 deaths a year, and half of those are in Asia. But we also know that it's underreported because a lot of the diseases that are associated with extreme heat, as well as the impacts on chronic disease, are not oftentimes associated with what is happening in extreme heat. Wellcome Trust does a lot of work on research and understanding how those health outcomes will come about. So what I wanted to do is just start with you, Alan, to really talk about what solutions are you seeing in the research that you're doing that the risks of extreme heat pose to health? And then where do you think there's more research required to actually understand the full impact of extreme heat?
Fantastic. Thank you very much. Okay, so I'm going to split it into what we know and what we don't know. So it's quite interesting when you understand, when you start delving into the issue of extreme heat. So we know exactly to the nanogram what happens if you put an Olympic athlete or a soldier, especially if they happen to be male, into a heat chamber. Because that's an experiment that has been done 100 times, 1,000 times, and we know what happens to the physiology and to the health of male athletes and male soldiers at very high temperatures. Because we need to know that for a variety of reasons, and that's information we know. We know almost nothing about what happens to a pregnant woman at high temperatures. We know almost nothing what happens to a young infant at high temperatures. So there are so many things where the evidence base just isn't there because it's never had to be asked before. And I think, so at Wellcome Trust we are determined to fill that evidence void. So we have a whole load of evidence on some things, male health, extreme heat, but we know nothing about some of those other areas, the most vulnerable populations. What we do know is that extreme heat kills lots of people. Not only does it lead to 500,000 deaths a year, but there's also huge amounts of illness, morbidity that happens as a result of heat and heat stress. So building that, and we also know that we can also now attribute excess deaths directly to climate change. There are now the statistical approaches to enable that to happen. So there's a very clear attribution approach between climate change and heat-related mortality. That's the stuff we do know. We know lots of, so we know about, we know that there will be impacts. We know that they're morbidity and mortality related. There are things we don't know, for example, on maternal and child health. There are things we also don't know, for example, on mental health. So extreme heat clearly leads to changing mental health. We have no understanding at all of the mechanisms underpinning that, and we've just closed a call for a global call on research to help us understand the biological, neurological mechanisms between extreme heat and mental health outcomes. We also don't know about the impact of extreme heat on infectious diseases, especially viruses and fungi. And some of you might have seen the news over the weekend. We've just, one of our grantees has just published a paper talking about the increased pathogenicity of fungi as global temperatures rise. So it's a slightly weird one. As global temperatures rise, so fungi adapt to living at a higher level, a higher temperature, and that higher temperature becomes more similar to the temperature of the human body, which enables fungi then to jump from the environment into the human body. So there are really significant concerns amongst the microbiology, the fungal community, about the risks of increased fungal infections as global temperatures rise and fungi adapt to those higher temperatures. So that's another example of something we don't know. Impacts of extreme heat on cardiometabolic diseases is another area. And as we've seen, so cardiovascular disease, diabetes, those things are now increasingly prevalent in Asia and Southeast Asia, and we don't know the impacts there either. And then finally, on the list of what we don't know, really at the level that we should, is the impacts of extreme heat on worker productivity, on livelihoods and economies. And if we're thinking about how to get governments to move, they might care about the occasional death. They might care about the occasional impact on hospitals and whatever, but they really do care about the impact of extreme heat on their economy. And that evidence base, therefore, is a really important evidence base to drive action. What is going to be the impact, for example, if entire parts of the population can't work because of extreme heat? What is the impact of that going to be on national economies and therefore, the state of the government? So I think there's a range of things there where the evidence base, this evidence, is going to really be helpful to drive policy and action.
I think that's great. And I want to turn next to you, George, because one of the things I think that Alan's talking about is actionable science, which is something that Community Jameel really believes in. And thinking about what science can be created that will drive to policy change, but also community-driven change. And what I would love to hear from you a little bit about is you do a lot of work in Southeast Asia, and so some tangible actions and tangible projects that you've taken on, which takes the research base and actually creates actionable change as a result.
Thank you for the question. And a big thank you to the Climate and Health Funders Coalition, which we're a proud member, and of course Philanthropy Asia Alliance for inviting us to this summit. I suppose Community Jameel originates in Saudi Arabia in West Asia, so we're part of the Asia community, as it were. No, I think, look, Alan set out a lot of the areas where scientific research is required to strengthen the evidence base and our understanding of the threats posed by heat. And Community Jameel, similarly to Wellcome, funds a lot of scientific research and development. But maybe to quote Alan, in a different setting, he's often said, and we agree with this, that it's all very well to publish your peer-reviewed paper in a nice shiny journal. It's another thing to have people actually read it. And I think that's what we're very much focused on, is how do we take that actionable science and ensure that action is actually taken. Looking at those three pillars that you had on the coalition slide earlier, Alan, there's the obviously data for decision making, and I think there, for example, I look at modeling as an important way to help policymakers think about different scenarios. I was just yesterday at the National Center for Infectious Diseases here in Singapore, meeting with Kelvin Tan and his team, and they're doing some fantastic work to model both the epidemiological risk posed by certain diseases and the economic impact of certain measures taken, lockdowns, closing down certain sectors of the economy, and all of that is vitally important to help decision makers take action. In the other areas, though, more broadly in heat, I think that a lot of the heat stress, we heard earlier about the risks in rural communities, but there's a lot of heat stress placed in urban settings. And one of the things that we've supported is trying to get scientists with the evidence embedded into urban planning teams in city authorities. And it sounds a bit niche, but what we found is that action can be taken rapidly and with significant impact by, town halls. And we've teamed up with C40, which is this collection of around 100 mayors of global cities, to pilot getting real experts on heat and other challenges posed by climate change embedded in city authorities. We're starting with 2 Asian cities. One is Chennai in India, and the other is Amman in Jordan. And we're excited to see how we can really galvanize action there. And the last area, going back to the coalition slide, of course, is around air quality. And there is that link between heat and worsening air pollution. And I think, again, there, we're similarly thinking about how can we get the scientists into the decision-making bodies. We're supporting a series of air and water labs who are doing really interesting things at different levels of government. Again, sometimes at city level, sometimes at state level, for example, in India, sometimes at national level. And just as one example of that, in India, in Gujarat, the team that's embedded inside the Gujarat state government has led the introduction of the first ever particulate matter cap and trade emissions trading scheme, which has had a dramatic impact in reducing particulate emissions by 30 to 40%, at no cost to the various businesses, the factories who are participating in the scheme. So I think, to conclude, I would say it's vital to build those bridges between the research communities and the decision makers, and that's something that we're very keen to see. But as a sort of PS, it's not just, there are other decision makers as well. I think it's key that we don't just focus on the top level. People need information to take their own decisions as well, and it's vital that there's multiple strands of information generation based on science and evidence. Thank you.
That was great. And I think this leads to, Mrs. Irani, what I would love to hear from you is, we're talking about the research base, but the research base actually has to be translated into policy and action. And I think Alan spoke to vulnerable communities, particularly women, that a lot of the research has not been done on to date. And they're particularly vulnerable, especially in India. And I think we heard some examples in rural communities from Dipali, but there are other examples also in urban settings, as George was talking about. Based on your work, both as a cabinet minister, but then also the work that you're doing now, it would be great to hear from you how you think about vulnerable populations and how you translate some of the learnings that you're getting into actual policy action.
I think the platform in itself is eye-opening, because for Alan to say that gender segregated data is not available, but neither are available insights as to what happens to a population, possibly which is pregnant and faces heat up to 40 degrees. In fact, there is research available. It is the first ever research done across 20 agroecological zones in India, which was funded by our alliance, which looked on the impact of the heat wave on women and children. One found that the probability of women giving birth preterm rises by 20%. And then it was seen in the state of Uttar Pradesh, where cases went up by 25%. In the state of Bihar, there was a 15% increase as reported by WHO in hospital admissions due to diarrhea and heat wave related diseases, a 12% increase in cases due to contaminated water due to heat wave. The coalition, I think, is best served when such data, experiences, associations, collaborations can find that one platform where that information resonates and not oscillate only between policymakers and research associations or philanthropists. I think in our alliance, we are today at the crossroads of both research organizations, research fellows, policymakers, local administration, and advocacy groups. Apart from creating a collaboration and an ecosystem, one needs to wonder that if 7 million people are dying due to air pollution, why is it not raising an alarm across the world? If 500,000 people are dying because of the heat wave, why is it not raising an alarm across the world? Looking at my personal experience, I'm of the opinion for too long, climate crisis has always been looked upon from the humanity lens. It is imperative upon us to now also put on the lens not only of gender, but also economies that will get disrupted. The central bank in India has in fact informed public at large that the GDP loss to India by 2030 because of extreme heat will be up to 4.5%. That the world over, there will be 80 million job losses, of which 34 million will come from India. And I think those are the numbers that may send alarm bells ringing amongst industry captains, because that is the one facet which on this panel today does not find a reflection on. Industry presumes in many places that heat is an individualized community issue that policymakers need to deal with and philanthropists need to advocate upon, or for that matter, research organizations need to find more data to inform policymakers better. The gap today is the lack of information within communities. It is a given temperatures will rise. It is a given that there will be disruption due to air pollution. The fact that advocacy in terms of immediate impact on health, immediate impact on the purses of that individual family, immediate impact on the infrastructure of the community, there is an urgency to that information which is currently, I feel, absent in conversations and also on the grassroots when we go to work. It is a given, if you're in the desert, there will be a rise in temperature, but not many can actually affect conversation as to how much that rise will affect not only daily livelihoods, but in fact be a danger to life. Until such time we do not take such coalitions, the learnings and the alarm bells to that community at the grassroots, to the last woman or man standing, I think that forever this gap will be widened or in some way propagated or precipitated. It has to be a holistic collaboration between industry. If this was a room that spoke about global disruptions due to tariff, it would be filled, every seat taken. The fact today that we spoke about, and Alan spoke about 7 million deaths, and there are still seats empty in the room, that's the first problem that needs to get addressed. What is the value to human life which gets affected due to climate crisis? And why is it that red flags are not rising the world over? Why is it that the issue of climate has become the issue of activism? And I think once you talk about the effect that you wanted to take, issues and research with regards to gender will also follow through. But Sonali, just to round up what I was trying to say is we began the study with agroecological zones, and George in his conversation spoke about Gujarat. In fact, Gujarat, a municipal board in 2013 came up with the first heat action plan, which then became a plan that got replicated across states. But what we found in the second study that we are funding currently in India, which is undergoing, is the impact of extreme heat on women and children from a health perspective. And we find that though action plans are made as per geographical zones, agroecological zones are transcending those geographical zones. And we need to create more collaboration, a more cohesive approach, which manages both the boundaries of agroecology and the geographical, I think, distinctions that limit certain government interventions, given that, at least in my country, it is a federated system of management.
That's really compelling, and I think speaks to one of the things that the Climate and Health Coalition is really trying to think deeply about is how global funders come together with local funders. So you get the deep knowledge and the understanding of what is happening in the local context when you actually work on some of these global issues like extreme heat. And now that we've talked a little bit about India, Benedict, I'm going to come to you last to talk a little bit about how you are seeing extreme heat show up in this geography, in this region, and how you're thinking about it across Southeast Asia, and to give us a little bit of a flavor of the work that you're doing here.
So I'm not an expert, not like all my fellow panelists, but perhaps I can take a step back and try to draw attention to two intersecting vicious loops. When you apply the systems thinking to the whole set of issues, at least what we've done, we've come up with two very interesting intersecting vicious loops. Heat affects the productivity in agriculture. Water may not be enough. So Southeast Asia is known for its agriculture, and we have lots of farms, smallholders, and so on. So that vicious loop, if agriculture is affected, what happens? The temptation to clear more land for agriculture, which means the carbon sequestration or the carbon capture goes down. So there's this terrible vicious loop of if agriculture productivity goes down, we are all affected, right? The global warming will continue. But also, nutrition goes down. We talked about nutrition on day one. The value of nutrition from agricultural products also go down because of heat. But an interesting link to the other vicious loop is that farmers, or at least the next generation of children whose parents are farmers, now see that their livelihoods are not going to be that promising in the rural regions, in the agricultural sector. So what do they do? They migrate to cities. And this is what's happening a lot in Asia. And then you get this other vicious loop of heat and stresses in cities. Right? So water supply, cities have not been designed to have water spaces and green spaces. And now you have a large group of numbers of people stressing the city as well. Cities are not like our homes or apartments where we can renovate in 3 months. I think if you look at Europe, some of the European cities, it's very difficult for them to even put through a new set of sewage systems, right? In Asia, it's the same. The older cities, it's very hard to just renovate your city. You have to rebuild your city somewhere else. And that causes a whole set of problems with urban heat. Another vicious loop there, because what do we do when we have urban heat? We have air conditioning. And again, we increase the carbon footprint. Okay, so that whole set of these two intersecting loops are really causing a lot of problems for us. And if you want to apply the systems thinking view of things, then philanthropy must be able to find those leverage points, both in the agriculture sector and in the urban sector, how to get through and break through these vicious loops to take us back, at least lower our carbon footprint so that global warming and heat doesn't become a big problem. And I want to echo also what Alan has said about infectious diseases. As more and more people migrate to cities, and with the heat, with urban heat, what happens? Vectors especially, they reproduce faster, right? So in Singapore and in many parts in Southeast Asia, dengue is a big problem. Okay, so this is the other element of the vicious circle within the urban setting. So my encouragement to everyone here, and let's work together, and we have started some work in this. We're not, by far not the best in systems thinking, but if you have done work in this area, please connect with us so that we can continue to form the picture of what's happening and then continue to amplify. So the role of the Temasek Trust and the Philanthropy Asia Alliance, I'm not so sure how many of you are senior enough. No, when I was a young person, the way I would play music was to put a vinyl record. You remember that? Yeah? And then the stylus. But you need two things to hear the music. You need an amplifier. And to get the right balance of music, you need to play with the bass and the treble and the mid points. And that's your synthesizer. So that's what we try to do at Temasek Trust. We try to synthesize and then amplify. Thank you.
That might have been the best analogy I've heard this week. And by the way, I had records as well when I was younger. The last question I kind of want to ask of this panel before I open it up to the audience is what we're trying to do here is really create a climate and health coalition. And what that means is building on the work that each of these individuals is doing on the stage and collaborating so the whole is greater than the sum of the parts. And so one of the things that I would love to open it up to, and feel free to brainstorm up here, but where do you actually see synergies in the work you're doing? So Mrs. Irani, like where could global philanthropy come in to really support the work that you're doing locally? And what kind of role could that play?
I think Benedict was very well positioned to be the synthesizer of the orchestra that he hopes to play someday, minus the two sides, and have every side then get represented. While there has been a robust conversation on the impact of, let's say, heat, there are certain aspects which are takeaways from such conversations which never find a spot in the mainframe. For instance, from a gender perspective, it is said that, and this is some research that was done in India, maternal anxiety goes up by 18% because of crop failure, because of extreme heat. And anxiety, mental health are not issues which normally are publicly correlated with the heat impact. So whenever there is an opportunity for organizations to come together, though there is conversation on the larger impact on health, I hope that the mental health or anxiety aspect on a young mother and a child under the age of 5 finds resonance in it. Intimate partner violence goes up by 26% in such families because of extreme heat. Again, that normally doesn't find a mention in most organizational exchanges. And I'm hoping this is a place where, let's say, if somebody like Benedict or Alan leads the coalition to find more people to come together, these are the issues that find a reflection. One of the biggest assumptions is that the extreme heat impact will only be seen outdoors. The indoor impact is normally never, find resonance with many people. The other challenge is that women are looked upon as a homogeneous gender who are supposed to have one impact irrespective of their age or their geography. The impact of extreme heat on menopausally transitioning women is much different as compared to women, let's say, in their early 20s or their late 20s. So I hope that gender segregated data and the fact that women at various stages of life will be affected by, let's say, heat in a differentiated fashion also finds mention. But I believe that agriculture is not the only segment that gets in an economy affected by heat. You have seen, and the RBI report speaks about various industries which will get affected, which includes factory settings for textiles, which includes mining, but also processing within the agricultural community. So I hope that the variety of economic sectors that will get impacted also find a resonance or also find enough research material to inform the coalition better.
Alan, would you build on that? Where would you see intersections where Welcome could come in to support some of the data that Mrs. Irani is talking about?
Thank you. I think thank you so much for being on this panel, Mrs. Oren. It's been fantastic to have your insights. I think what you're also demonstrating, though, is that the cross-cutting nature of climate change. I mean, you covered everything there, from intimate partner violence to the impacts on menopausally transitioning women. There's a huge spread of things that are going to be affected by climate change. And I think what's increasingly important for all of us to do is not just imagine climate change, that we will progress and will get slowly better and things will change or whatever. The thing that we really need to do is look to the future. What does the world look like in 10 years' time? So the world in 10 years' time, if we carry on as we are, is going to be really horrible. Much hotter, much drier, much more extreme weather events, all sorts of things are going to happen. What do we need to start doing now so that in 10 years' time, some of the solutions that we desperately need will be in place? So I think there's a real, I think it's a mind switch. It's because it's so easy now. So I fly back to London on Thursday night. Friday morning I'll be in the office and I'll just carry on as normal. Or Friday morning I go back to the office and say, all right, now I'm not just going to look at my horrible inbox, my email inbox, and go to all those horrible meetings I have to go to. I'm actually going to say, what do I now need to do to really make a difference? And I think that's the question, because we have to think, in 10 years' time, the world is going to be so different. What are the solutions? What are the partners? Who do we need to talk to? What are the systems plans? What are the maps? What are these things that we need to imagine for the future? And we need to imagine them now. Some of them will be irrelevant, some of them will get wrong, but a few of them might be just the ones. Those solutions, the understanding, the policies or the interventions, and the evidence base to underpin that, that's where I think there's a real opportunity. And I think also that's where the coalition has its strongest role to play, by bringing together all these various actors who work in different spaces, in different parts of the ecosystem, to say, let's imagine that future. Let's think, what do we need to do now so that in 10 years' time, it's still a livable world?
George or Benedict, anything you would want to add? We can close with our synthesizer on this, if George, you want to go first. Okay, well, why don't we open it up to questions from the audience, if there are any questions that you all have for everyone up here. Please, is there?
Thank you for a very enlightening presentation. Very good to know about the forming of the coalition and the priorities. What I felt was probably absent from the presentation, or probably not, willingly, but maybe it's in your discussions. How do you envision working with ASEAN, the Pacific Islands Forum, SAARC, UN SCAP? They have done a lot of work talking about some of the similar issues. But when philanthropy's agility and speed that Sir Jeremy Farrar mentioned again yesterday, compounded with the state in which these regional bodies are probably not being allowed to implement or speed up some of these, are you discussing about this, and what opportunities do you see in that front? Thank you.
I think from my personal experience, and I don't speak for the government here, there is a presumption that the climate crisis, let's say that Benedict reflected on in terms of migration, is an Asian crisis or a crisis of the global south. One has to see what is the disruption in conversation between the global north and the global south, where promises were made for financing climate action or adaptation that are yet to be fulfilled. From the Indian experience, we funded our own climate action. Today, our government has provided close to $400 million only to ensure that climate adaptation strategies and climate resilient infrastructure is built. But for how long will we have a very siloed approach? And your question, I think, reflects on the fact that there is a large part of the global community, in fact, which is left out of paying up. So there are many countries which are resolute with their climate action plan, but do they have enough money to then bring it to an implementing stage? So it may not be a challenge of resolve, it may be a challenge of the economies that those resolutions will affect.
Yeah, I may add, we had some level of conversations about working with governments and international organizations, multilateral organizations. And my view is, in Asia, this must be done with finesse. Someone told me some time back, when you have the word united in front of the name of an organization, it's really not united. No offense to the UN people here, sorry. So multilateral organizations have a place to play, have a role to play, and we can work through them, and we must work through them. And we must work with the local governments and national governments as well. But in Asia, we have to do this with finesse. Philanthropy must not show off or put them down or put people down, right? Sorry, my handphone is talking to me right now. I don't know why. Okay, now this is the trouble of not knowing how to handle technology. Okay, so the idea is this: you have to work with them, but you do it with finesse, and you work in partnership, because at the end of the day, there are only two ways to scale things: the government or the market, or a combination of both. So yes, definitely, there's scope for us to work together with all the multilateral organizations.
Just to jump in on that, I think you're right, of course, that you need governments and markets to scale things. But I think Mrs. Irani is also right that often it's a challenge of financial resource availability. And I think that in these straitened and turbulent times in which we find ourselves, when there is less money, often, particularly, for example, amongst bilateral aid agencies in certain countries in North America and Western Europe, it becomes even more important to be identifying those projects and programs and interventions, initiatives which are effective and which are based on science and evidence. And so I would actually, that I think is a key component of the interaction between philanthropy and these regional assemblages that you've mentioned. And just as outside of Asia for a minute, but I was recently in Brazil, and it was very heartening to see that the COP30 presidency is thinking about, for example, in the food systems space, convening a science and philanthropy advisory group to actively bring together both philanthropy on the one side and science on the other to identify, what is a good list of potential projects and programs that could be adopted and recommended to the COP30 presidency and to the member states at the COP. So I think there's an emergence of a general acceptance that we need philanthropy, but we also need to find those good projects, decent projects, effective projects, and then to develop channels and mechanisms to bring them to the attention of governments and these wider multilateral groupings that you mentioned. Thank you.
Yeah, I think that's really helpful to think about the catalytic role of philanthropy in science to make sure whatever is scaled is actually scaled and will work. I think I saw a few hands. Good. We'll come around this way.
Hi, Robin from World Economic Forum. I guess my question won't be a surprise, but we've heard a lot about how the research and evidence needs to drive government action. I'm wondering if you're thinking also about what businesses, companies, industry can do to protect workers and other populations from heat, and if you have thoughts on that.
Mrs. Rani?
I think evidence right now suggests that corporations, the business community is yet to catch up on the scientifically based evidences, projects, programs, interventions that are available as tools for implementation. And that is why for the coalition to have equal partnership with industry bodies is the imperative that I see. Most of the projects that you hear of in terms of even heat-related insurance does not come directly from industry. Most of it is then either government funded or funded by philanthropy. And that is why in my opening remarks I said that this is not a crisis that can be met only by policymakers and not only look at it from the lens of humanity. For companies to compute the productivity loss is, I think, the foundation on which they may start to build on how to protect not only workers, but also their systems and, in fact, businesses of the future.
Thank you. Thank you for that, the presentation. I thought it was really illuminating. I guess my question is around the use of the data. So we talked a lot about how we need to fit, there are a lot of data gaps. There's a lot that we know, a lot that we don't know. What I find quite striking is what we don't know is often how to communicate data to vulnerable populations. Where is the guidance on how you communicate the findings of the things that we want to discover here? The data has gotten so much better over the last 30 years. We get down to really localized level of analysis and understanding. But what we haven't gotten better at doing is communicating that data to vulnerable populations. The most vulnerable populations are usually the ones who we are least good at reaching. And so I think the key question for me is it's about complementing that data and complementing the analysis with the guidance to reduce exposure. How do we reach community healthcare workers on the ground in the most vulnerable communities with this information, with very practical guidance?
Yeah,
Thanks.
brilliant. I note we all grabbed our microphone, so so it's a great question. I'm just going to give some examples, and I'll be brief, and then everyone can have a go. It's a really, really important question. Clearly, the most important thing not to do is publish a paper, because no one reads them. So what we really need to do is use that evidence. I mean, I've published a whole load of papers that no one's ever read, but use that evidence in a clever way. So, for example, at the Wellcome Trust, at Wellcome, we increasingly work on with the creative and cultural advocacy routes. So that means, for example, about a month ago, we opened a new gallery at the Natural History Museum. So, and it tells us, it's called Fixing Our Broken Planet, and it's got a huge amount, it's got really nice examples of how climate change is going to affect human health and what the solutions might be. Now, 3 million people a year might go to that. They're all largely middle-class English people, so whatever. So that's a sector. But then, you know, we can use that approach in other ways. We work with the media, we work with the BBC to shape storylines in sitcoms and in television programs. We work with the news people and the sports people to help them understand, you know, what the climate crisis is and how it affects health. We work with Grey's Anatomy, the US drama had 2 stories now on a heat dome, which we provided the story and the evidence for. So we're using, because you're right, how do you get this message across in a way that people remember it? Yeah? And so we're using a variety of different approaches to see how we can embed. So that's just one example, but I'll pass down the line. George?
Well, I just wanted to, very good question. Rumsfeldian in its known unknowns and unknown unknowns. But I just wanted to make one point, and I don't mean to impugn this on you, but I think it's worth just pointing out that I do think, and we think, that it should always be a two-way conversation, because of course there is fantastic knowledge and information that can be shared that has arisen from scientific inquiry. But communities themselves are often the best informants to others of what's happening on the front line. And so making sure that there's a trust-based knowledge economy between whether it's agricultural communities or anybody else, people who are on the front line facing the brunt of climate change, but who themselves are seeing firsthand what's happening on the ground, being able to communicate that data back to, for example, scientists, modelers, whatever it might be, who themselves are then producing other data outputs and information outputs. That two-way exchange, I think, is vitally important.
I think mediums of communication have seen a lot of disruption. So what may be true for the Grey's Anatomy, let's say a decade ago, is not true for television the world over today. 86% of communication has shifted online. Are we still tick-tocking our way to an environmentally friendly world is a question communication specialists need to ask today. The challenge is that today's communication speaks to one factor and one factor alone, that environmentally based communication is the agency of either environmental agencies, environmentally inclined scientists, or policymakers, and even amongst policymakers, it is limited to the ministries of environment, or for that matter, those segments which respond in emergencies to climate crisis. Now, the conversation today, I think, has sufficiently highlighted that the heat wave, for instance, will impact housing as much as it will impact, let's say, health, as much as it will impact urban infrastructure, given migration is a given. If we start even preparing those community leaders who work at the crossroads of both policymaking and community leadership, you will have systems efficiently ready to service the needs of the community, are not limited only to the environment specialists. And I think that's one of the greatest challenges. Right now, the responsibility seems to be of only the few, and the impact is on the many.
Yeah. My question is for George. Thank you for raising the importance of embedding scientists in decision-making and building bridges between research communities. Working in a university, this really resonates with me. In my experience, this has been incredibly difficult. I think scientists really live on a different planet. So I'm curious, what's been your experience working with scientists in these settings? And have you found effective ways to build bridges?
Yeah, well, good question. I mean, look, maybe I've been lucky, but the scientists who we've had the great privilege to support tend to be, yes, they're working in academia, but they are deeply committed to seeing the work that they're doing have an impact. And I'm sure they're as frustrated as anybody when nobody reads their journal paper. But they're looking for tried and tested methods. So one research center that we support is called JPAL, the Jameel Poverty Action Lab at MIT. And about 11 years ago, they celebrated their 10th anniversary. And for the first 10 years, they'd been doing their sort of bread and butter work, which is running randomized control trials of what works in alleviating global poverty. And this experimental approach, widely known in their community, was successful up to a point, and they were producing lots of peer-reviewed papers. But they thought, how do we now take that to the next level? We know which kinds of interventions, including in the health space and including in what we would now call climate and health. We know what works, but how do we get people to scale it up? And that's when we supported an initiative called something like Innovations in Government Initiative or something, which was initially basically sending one person, a JPALer, to go and embed themselves in some government body. It could be at various levels of government. And they would just make themselves extremely useful doing like PowerPoint presentations on subjects completely unrelated to their research. But what they found was, as they became more sort of useful and more embedded, they saw the opportunity to say, by the way, have you considered this alternative approach, which is actually supported by evidence in this peer-reviewed journal? And often they found that policymakers were extremely open to this and thought, well, that does sound like an interesting approach, and it's backed up by evidence. And that whole model has kind of evolved over time. And a few weeks ago, JPAL launched something called ADEPT, which I'm not going to remember. It's called the Alliance for Data and Evidence in Policy and Training or something. But the idea is to build cadres of sort of informed consumers of data and evidence in government bodies all around the world. And I think that's probably the key learning of the last 10 years of JPAL doing this, is that you need to have people who understand the kind of data that you're producing. Now, part of the responsibility for that is on the scientists to produce outputs which are easy to understand, but oftentimes you do want to have people inside government who are, as I said, sort of informed consumers. And of course, it's not just JPAL that does that, it's many others as well. But I think that's a sort of key aspect. And so training and capacity building amongst government officials, civil servants, what have you, is absolutely key.
The one thing that I would add to that is one of the things the Climate and Health Coalition has been thinking about a lot is narratives. And I think, to your point, a lot of the narratives around climate change are difficult to understand because they are very academic. And so one of the things we're thinking deeply about, particularly in the air pollution pillar, is how do you actually make this accessible where someone understands what they personally need to do based on the science to be healthier? And how do you make that simple enough that it's easy to understand or access for anyone, as opposed to being a really academic exercise? So there's government, which I think, George, you spoke to, but there's also just people, and how you actually translate climate and health outcomes into something that people can take action on.
Maybe I can just add a story to this. And I'm not going to name the community, or just to protect the innocent and so on. But a typical method of clearing land after agriculture harvest is to slash and burn. In many parts of the world, not just Southeast Asia. And that produces all sorts of pollutants, and the wind blows the pollutants to the neighboring communities. People in the communities were accepting this as a norm until we told the story to the mothers. I said, do you know that the development of your child's brain is going to be affected by these pollutants? And so what happened was the mothers got together, formed a coalition of sorts, went to see their local government, went to see their local authorities and say, you need to do something about this. So you bring the narrative right down to where it affects them most. Again, reminder of what we shared this morning in one session, storytelling. Thank you.
I think we can take one more question.
Hi, my name is Michael. I'm from the climate finance side. So my question is, like to add on to what the lady said about scientists, having interesting ideas. I think one of the heavily debated topics addressing, global warming is solar radiation management. And I'm wondering what's your thoughts about it, because I mean, even some of the solutions for this is from using chemicals like calcium carbonate by one venture that's funded by Bill Gates as well, to blot out the sun, or to using space tech to actually, to reduce the amount of radiation, solar radiation onto the Earth. So I'm wondering whether that is a feasible solution, or is there a better way to address this?
All right, that's a bit of a grenade to throw in at the end of what was a relatively peaceful and friendly session. So there's a question, if you didn't hear, just about the value of geoengineering, basically, the geoengineering approaches. So where do we start? It's a really, really, really important question, is number one. There are many, many individuals and countries developing geoengineering responses at the moment, number two. Number three, we have almost no idea what they will do in the chemical space, in the atmospheric space, how long they will last, their short and long-term consequences. And number four, and this is the thing that worries, I mean, they all worries me, but the number four is we don't know the consequences on health of any of those actions. So for example, it's quite possible you do some geoengineering, you do some solar radiation management, it is then cloudy for the next 10 years. Yeah, it's not impossible that could happen. That's pretty grim. Yeah, so you would never see the sun again for extended periods of time. It's not impossible that that is an outcome of large-scale geoengineering. I think before we do anything like that, we need to take some we need to do some very serious thinking about whether this is a sensible approach, modeling for the likely impacts and understanding the science. But however, all of that said, there are clearly groups in the world that are already thinking very carefully about this, and I suppose the concern is that people will start experimenting before there's a general agreement about whether the world is ready for that sort of action. But thank you for ending us on a slightly nuclear note.
Okay, well, thank you for the SRM question, and thank you for all the questions here. And as you can tell, this panel is much more focused on innovation that is related to adaptation and mitigation that you can do today, as opposed to some of these more future technologies which are untested and would require a different type of innovation and a different type of research to really enable. But what I wanted to do to close this out is Benedict is going to close this out as our local Southeast Asia philanthropist and talk to us a little bit about the call to action around extreme heat. I think we've talked a lot about the work that everybody is doing here, but there's a lot more to do, and this is going to become a bigger and bigger problem over time. So we'd love to hear from you, Benedict, on how everybody in this room can kind of get engaged and get involved.
So Sonali, I'll send you my fee later for you, to cover. I'm going to speak a bit of Singapore English here. 2 questions. They were raised by my fellow panel members here. Why no action? Why slow action? So the way the issue of climate and health as an intersection that throws up lots of issues is actually like most of the wicked challenges we're facing today. And if many of you who have heard these 2 management stories, if you have attended any decent management training program, to me it's the story of the boiling frog meets the 5 blind men and the elephant. Okay, I'm going to repeat that. It's all lost out here. It's the story of the boiling frog meets the 5 blind men and the elephant. In case, I just elaborate a bit. If you throw the frog into hot water, the frog will just jump out. But if you put the frog into water and slowly boil it, it will not jump out because its body adjusts to the outside temperature, and before you know it, you can have frog soup for dinner. Boiling frog. 5 blind men and an elephant, different parts of the elephant, and we don't know what we're doing. We think we're solving the problem one item or one element at a time. So climate and health intersection is about this. So it requires all of us to come together, exchange ideas, exchange knowledge, data, science, proofs, get the interventions together in place-based solutions in local communities. And this is the call to action. We have this coalition here. If you're interested in finding out more, please see Sonali. Some of you are already signing up for the Philanthropy Asia Alliance Health Community, and you may think it's a duplication. It's not. We're going to pull the 2 together in some way. The intersection, again, of these 2 communities working together on climate and health as an intersection, which will throw up issues like heat, air pollution. My favorite topic was water, but they told me you can't talk about water yet, so fine. But we'll get to water at some point. Right? And so this is the call to action. We need systems thinking. We need people to act together who understand each other, understand the issues together, to complement each other towards collective impact. Thank you very much.
Thank you to all our panelists. This was wonderful.